This video provides information from the internet, and we do not promote any products or medicines. Always consult a doctor before using any medication. We are not responsible for any side effects or issues resulting from self-medication.
Asmygaba M Tablet is a combination medication used to manage nerve pain. It contains gabapentin and methylcobalamin, which work together to alleviate discomfort caused by nerve damage. Indications and uses. This medication is indicated for the management of nerve pain, particularly neuropathic pain, which may arise from various conditions, including diabetes, injuries, and other nerve-related issues. It provides symptomatic relief, helping patients regain a better quality of life by reducing pain sensations and promoting nerve health. How it works. Gabapentin reduces pain sensation by interfering with the transmission of pain signals between damaged nerves and the brain, while methylcobalamin promotes the repair of nerve cells and improves the protective myelin sheath around nerve fibers. Directions for use. Take this medication as prescribed by your physician. Swallow the tablet whole with a glass of water, do not crush or chew it. It can be taken with or without food. Your doctor will determine the appropriate dosage based on your specific health conditions, age, and body weight. Do not stop taking it suddenly without consulting your doctor, as this may lead to withdrawal symptoms. Possible side effects. Common side effects may include dizziness, drowsiness, nausea, fatigue, and emotional changes. It is essential to seek medical advice if any symptoms become severe or concerning. Precautions and warnings. Before starting treatment, inform your doctor about any pre-existing health conditions, particularly those related to the liver, kidneys, heart, or lungs. Pregnant or breastfeeding women should consult their healthcare provider before use. Caution is advised when driving or operating machinery due to the potential for drowsiness. FAQs. 1. How long will it take for the tablet to start working? It may begin to relieve pain within 2 to 4 weeks. 2. Can I stop taking it suddenly? No. Consult your doctor before stopping to avoid withdrawal symptoms. 3. Is it safe to take with alcohol? No. Alcohol may increase drowsiness. 4. Can this medication cause weight gain? Yes, it may increase appetite, leading to weight gain. 5. What should I do if I miss a dose? Take it as soon as you remember unless it's close to the next dose. Thank you for watching this video. If you have any questions or suggestions, please feel free to leave a comment below. We appreciate your support.